Thank you for joining me for this training on success with simulations. I found this old Chinese proverb. It's tell me I forget, show me I remember, involve me I understand. So I thought that was fitting for this training. Okay, so what is a simulation? A simulation is an imitation of an existing process practiced in a controlled environment in preparation of an anticipated event. Simulations can be virtual, and at Ross we use SimTix, SimChart, publisher materials, or they can be in person, procedure, proficiency practice, role play, CPR BLS training, program assessment scenarios. And simulations can be written, they can be audiovisual, or they can be live. So we have quite a few different choices when it comes to simulation. We typically don't think of a procedure practice when we work in the classroom as simulation practice, but it is. All the tools are used to help students prepare for the actual patients they'll treat in the workplace. SimTix, although it's no longer used in the MA program, is still used in the dental assisting program. These procedures help prepare students through practice to perfect procedures that they will need out in the dental assisting field. And then we have SimChart. SimChart is a program that is a simulation program that the MA students use to become comfortable with the skills that they need to use out in the field in the EMR or the EHR. And then, of course, we do have SurePath, which would include our publisher materials. SurePath has some virtual simulations that students can work through. I suggest that you work through these as class together. Okay, and then role play. Many of our instructors have scenarios that they role play with telephone answering, taking messages. Role play is very, very important, especially with the soft skills that many of our students need to continue to perfect. And then we have CPR BLS training. Yeah, it's a simulation. We're using mannequins to simulate somebody whose heart is stopped, as well as our BLS training, which is helping our students with bandaging and learning how to treat patients who've come in with first aid injuries. And then, of course, we have our program assessment scenarios. These scenarios are used at the end of every module in all our programs to help students with their core skills and to keep their procedures sharp and ready for externship. Okay, so the purpose of simulation. Simulation learning encourages higher order learning, which promotes critical thinking abilities and self-directed learning. So that's Kreber. And Hakim found that students involved in experiential learning have a greater understanding of their subject matter than students in a traditional lecture-only class. Then we have Rocha, who reported that students enrolled in classes where experiential learning methods are used perceive themselves as more competent practitioners than students in classes without these methods. So what is higher order learning? Higher order learning is when students use critical thinking and problem-solving concepts to solve answers or procedural challenges. And then we have experiential learning, which is learning with hands-on experiences and reflections. So that is by doing. Okay, so let's get some simulation insight by watching this short video.
You can go ahead and pull this out. We'll change back to worksheet. My name is Ben Joyner.
So I hope you enjoyed the short video as much as I did. Even though the simulations that are used in this slide, we don't have here at Ross, we do have similar simulations, and the student's experience can be enhanced by using those. Okay, so preparation. Most simulation in the creator suggests that simulations work best when simulations are tied to the course goals. All of our simulations are put in courses that go along with the lesson plan and the chapters that the students are currently working in. Instructors read all the supporting material for the simulation and do a trial run or participate in the simulation before assigning the simulation to students when possible. It's really, really important for all instructors to be prepared and knowledgeable of the simulation, so they work out any bugs before the students get into the simulation. That will definitely help with our student understanding of the procedures that they're going to be working in. And then instructors integrate instructional simulations with other methods of teaching, such as cooperative learning, which would be group work. Instructors should anticipate ways that a simulation could go wrong and include this in their pre-simulation discussion with the class. So instructors are going to introduce the simulations and talk about the simulations before the students actually practice them. So effective learning comes through simulations when students are actively engaged in the simulation. Students should be able to predict and plan the outcome they expect the simulation to generate. Students should understand how the simulation correlates to core skill development. And they should be able to understand that those core skills are going to help them be more successful once they're out in the workforce. It should be hard for students to be passive during the simulation process. Students should be given clear roles by the instructor when they participate. They can be the MA, the DA, the VA. They could be the patient. They could be the physician. They could be anything that the instructor thinks would be helpful during the simulation. And if possible, simulations should provide students with different scenarios and alternative outcomes. So think about what could possibly happen or go wrong during a procedure, and see if you can tie that into your procedure practice. Okay, then we have reflection. Now, this is a really important step in the simulation process. Post-simulation discussion with students leads to a deeper learning. So the instructor should provide sufficient time for students to reflect on and discuss what they've learned from the simulation. And that could be, what did you learn? What would you do differently in the future? And what other outcomes may occur? Those would be what ifs. What if the patient moved during a blood draw? What would happen if a patient passed out? What would happen if another emergency came in at the exact same time you were doing this procedure? So those would be good what ifs. So simulation advantages. First advantage would be simulation can improve participant skills and allow them to learn from error. Learners are able to gain a greater understanding about the consequences of their actions and the need to reduce any errors and prevent them from happening again. So for example, that would be, what would happen if a student drew up 0.5 milliliters of medication and the order was only for 0.05. They need to understand what can happen if they don't do something right. Learners address hands-on and thinking skills, including knowledge and action, procedures, decision-making, effective communication during the procedure. They can work as individuals or teams, and this allows for exploration of human factors and their interaction with their environment. Also, an advantage would be feedback that can be given to learners immediately and allow them to understand exactly what went wrong or right. It's really important to tell them what they did right so they can feel good about their choices and how they can improve. And then we have our debriefing tools, which can be video feedback, peer review. Those are all key features in the learning strategy. Video feedback could be the student has someone take a video on their phone of them using the autoclave, and then they can go back and review that video and reinforce what they did right, and then recognize what they didn't do right. Okay, so simulation and disadvantages. Simulation is not always able to completely recreate real life situations. Yeah, of course it can't. And if technology fails, like in the virtual simulations, for example, like Simtex, for just 1 second, it can be really difficult to get that student back into the moment and refocus on the simulation task. Sometimes they get discouraged, they get frustrated, and they just don't want to go back in. The results and feedback are only as effective as the actual training provided and the in-person person's running the simulation. So it's important to be prepared, and often too little emphasis is put on the personal reflection of the student and peer review elements of the simulation event. So they really don't get that review. They don't get to think about what they do better next time or how to improve their skill. And then students are never really subjected to the consequences of the mistakes that they make. Students that are underperforming and not being fully engaged in the training, and then their results are inaccurate. Some students or participants learn how to play the simulation game rather than how to treat the real patient. So they're more interested in passing the simulation, getting a good grade, than they are of mindfully thinking about the steps, why the steps are important, and the order of the steps, and their importance of the order that they need to follow. So what do you do if a student does not want to participate in a simulation? And this does happen. You must have a point to the simulation. So students really need to understand why they're doing the simulation and how it's going to impact their career. You can share something you observed or experienced related to reluctant participants, or you can talk about how the procedure that the simulation is reviewing is important to, was important to your career or to the treatment of a patient. It's important to explain the purpose of the simulation and the expectations. Students enjoy the interaction, and the majority of students say that it is a very effective way of learning once they get into the simulation and they understand how the method works. And remind students of the importance of these skills to their future career success. So how to overcome student simulation problems. First, instructors should have already completed the simulations before students get to do them. That way they can identify possible challenges, mouse placement, video glitches, confusing wording. They can explain that ahead of time. And then if a problem does occur, know how to contact the virtual simulation provider for support. IT phone numbers that you can give your students, chat features that might be available, login, password reset procedures. And then it's really important to also have a plan B, just to substitute a virtual simulation. If that's used in class and it's not working properly, you will have a backup in-person activity, or you can do some role play. If time allows, complete virtual simulations as a class using the projector. Many students really like that. They have you there. If there's a problem, they know that you know how to fix it. And then make sure that you're offering support to students that are experiencing problems after class so that they feel supported and they have the information they need. Now, we did have a question that was asked, and one of the campuses wanted to know if these simulations for the MA program are up and running, as they are an administrative instructor. The Simtex simulations that were used in the MA program, they were available to students during the time that we were shut down for COVID, and we have just recently removed them from the program, as we have a majority of students back in class doing the in-person simulations. Now, with this said, we do have plans to reintroduce virtual simulations. We're working on finding the best way and the best vendor to go with to re-implement those back into the MA program for students. So with that, I have no other questions to answer. I hope that this training was helpful to you. If you need a certificate for an in-service, please contact me and let me know one way that you are going to be implementing simulations in your classroom. Thank you, and have a good rest of your day.